Mr. President, this week, the Supreme Court's going to rule on the president's health care law. You'd have to live under a rock not to realize that it's going to happen Thursday morning at 10 o'clock. We have waited patiently every time the Supreme Court has rolled out their announcement for the last 3 weeks, I think, of cases that they had decided as the court comes to the end of their summer business. 2 years ago, then Speaker Nancy Pelosi told Americans, and I quote, "We have to pass the bill so that we can find out what's in it." We have to pass the bill so we can find out what's in it. Seems fitting that we stop and take stock of what the American people have learned about the president's health care law over the past 2 years. American people have found they can't afford the president's health care law. The Medicare chief actuary, in his final estimate of the health care law, projected that it will increase health care spending across the economy by $311 billion. Now, that's a 10-year number. But understand that the president promised that the health care law would reduce cost. It wasn't a goal. He promised it would reduce costs. Unfortunately, it's made things worse by increasing health care costs, and I think that the Medicare chief actuary is probably a very conservative estimate of an increase of $311 billion. Growth in the U.S. health care spending will almost double by 2014 due to the president's new law. Now, this is at a time where we already are in a situation where it's financially unsustainable on the path that we're on. The predictions of the president's health care law increasing insurance premiums are already being felt by the American people. Depending upon where you live, depending upon who your employer is, depending upon whether you buy your own insurance, depends on how hard you've been hit. But there's nobody in America that has not seen their premium go up since Congress passed this health care bill that was supposed to reduce the cost of health care. The Congressional Budget Office estimated that the new law will increase health insurance premiums by 10 to 13%. This means a family purchasing coverage on their own will have to pay $2,100 a year more because of the president's health care law. And by the way, 10 to 13% is what many Americans have felt as an increase on an annual basis. New taxes on life-saving drugs, devices, and health plans. Now think about that with the hour I just finished. I just talked about the fact that Congress needs to be focused on the efficiencies of government, how we bring innovative products, devices, pharmaceuticals, biologics, generics to the marketplace. And embedded into Obamacare are new taxes on drugs, devices, and health plans. American people hadn't felt this yet. At a time that we're supposed to be passing legislation to bring down health care costs, not only does the Congressional Budget Office say this is going to increase the premium cost, not only does the president's chief actuary, CMS is under the executive side of government, it's not under Congress's authority. He said that the health care spending across the economy based upon the health care law is $311 billion. We have yet to kick in the new taxes on life-saving drugs, devices, and health plans, which will drive up consumer cost and additionally drive up premium cost. Just after passage of the new law in May 2010, the director of the Congressional Budget Office said, rising, and I quote, "rising health costs will put tremendous pressure on the federal budget. In CBO's judgment, the health legislation enacted earlier this year does not substantially diminish that pressure." The question is, what were we thinking? And now we've got the court to decide whether this is constitutional or not. CBO's latest long-term fiscal outlook notes that the spending on health care has been growing faster than the economy for many years, posing challenges for Medicare, Medicaid, state and local governments, and the private sector. You know, sometimes this is missed by members of Congress and our constituents. There's a tremendous cost that we shift to the states and to local governments, depending upon how they share in the Medicaid state obligations for cost sharing, where states are picking up a tremendous amount of additional cost because of the passage of the President's health care plan. Because we're doubling, through legislation, we're doubling the amount of people that are on Medicaid. So now you're going to get hit by the increase in your insurance premium, you're going to get hit by the increase in overall health care costs, you're going to get hit by the new taxes on life-saving drugs, devices, health care plans, and, oh, by the way, you're going to get hit in your state taxes because of the increased burden of Medicaid beneficiaries who are in part funded by the state and are going to now require states to find new ways to raise revenue, which is typically through our state taxes. CBO's right to conclude that such rates of growth cannot continue indefinitely because total spending on health care would eventually account for all the country's economic output, which CBO concludes, and I quote, is an impossible outcome. Well, Madam President, we need real reform that actually lowers costs, not increases cost. We need real policy that institutes better outcomes, not rationing of care. And the American people need to look at what the President promised when he created this legislation. He promised that if you like your plan, you get to keep it. Unfortunately, the administration has estimated that up to 69% of all the businesses could lose the ability to keep what they have as a result of the administration's grandfather health plan regulation. The former director of the CBO, Doug Holtz-Egan, warned that the law, and I quote, provides strong incentive for employers and their employees to drop employer-sponsored health insurance for as many as 35 million Americans. Well, if an employer drops their health care coverage, how can the employee cash in on the President's promise to keep what he's got? Millions of seniors will lose access to their Medicare Advantage plans. Now, I'm not quite there, but some of my colleagues have reached that magical number. Do seniors not deserve choice? Is that what it is? Do we just want to give them one thing and no choice? And the truth is we allowed, we didn't create, the private sector created. We allowed the private sector to create Medicare choice years ago. And for many seniors, they chose to take the private sector product. Why? Because it provided more coverage to them. It provided preventative care. They actually got covered physicals every year. In many cases, they didn't have co-payments. In many cases, their prescriptions were covered long before we created Part D Medicare. So what's the President's health care plan do? It tightens the requirements on Medicare Advantage to the point that some seniors who are on it today will lose it because it's no longer an option in the markets they live in. How in the world can you do that and make a promise that if you like it, you get to keep it? Health plans offered by religiously affiliated organizations will be compelled to offer products that violate the tenets of their faith. a new mandate that jeopardizes employees' existing coverage and infringes on religious liberty. Well, that's going into a ground we've never gone into. And I think there is a reason that we've allowed people to hold to the moral standards that they felt were important. Then Speaker of the House Pelosi said that the health care law will create 4 million jobs, 400,000 jobs almost immediately. Yet the director of the Congressional Budget Office testified that the new law will reduce employment over the next decade by 800,000 jobs. Think about that. Then Speaker Pelosi said 4 million jobs, 400,000 just almost immediately. And the CBO director testifies we're going to lose 800,000. That's a difference of 4.8 million jobs in America. The President said that he was not going to touch Medicare. We heard that over and over again. He said to seniors, I'm not going to touch Medicare. He'd already taken Medicare Advantage away as a choice, but he wasn't going to touch Medicare. The law took more than $500 billion out of Medicare. A health care plan that today is not financially sustainable, and the President in his health care legislation shifted $500 billion out of Medicare, not to put Medicare on a sustainable path, but to fund new government programs the American people could not afford. Arbitrary cuts to providers that jeopardize access to care will not put Medicare on a sustainable path for current and future retirees. What does that mean? Doctor cuts. We cut the reimbursement to doctors. We cut the reimbursements to hospitals. We've now got doctors that won't see Medicare beneficiaries. If you're 65 and you move to Raleigh, North Carolina, the likelihood is you're not going to find a primary care doc that's going to take you if you're on Medicare. To that person, to that senior, that's rationing. I don't care how you say it. And the reality is this bill caused that. The President promised no family making less than $250,000 a year will see any form of tax increase. Well, I just covered a second ago. The new health care law is riddled with new taxes and penalties that directly fall on the middle class and will harm small businesses. New taxes on life-saving drugs, devices, health plans, they're all going to be passed on to consumers. You can't, it's disingenuous to say that everybody in the system is not going to feel the effects of taxes. They may not be directly on you, but they are on the products that constitute our health care system. We should be advancing policies that help small business to thrive in America, not policies that increase health care costs, policies that encourage innovators to export innovation and good-paying jobs overseas. We should be advancing policies that focus on helping to get our economy back on track. Unfortunately, the President's health care law does just the opposite. According to the U.S. Chamber of Commerce survey on small business, 74% of small businesses said that the health care spending law makes it harder for their firms to hire new workers. 30% said they're not hiring due to the law. There's only one issue in America: how do we get the American people back to work right now? How do we turn this economy around? You know, we can have all the cuts you want to have from a standpoint of spending, but unless we're willing to put Americans back to work and get them productive in participating in the revenue collection of this country, we're not going to get on a pathway to financial sustainability. This country wasn't created because people came here and said, let's create a place called America where everything's free. It was created as an area of unlimited opportunity. And that's why millions a year come here for unlimited opportunity, not for unlimited handouts. When de Tocqueville left the United States, he talked about the greatest country in the world. And he defined it this way: the capacity of the American people to give of their time and their resources for people who were in need. He never mentioned state or federal government. He talked about a responsibility of the American people to help somebody that was down on their luck, hungry, homeless. And you know what? For those of us that are adults, it's our responsibility to set the example for the next generation to come up and assume the same individual responsibility. But now it seems like all we talk about is legislation that inserts the federal government or the state government or the local government in the place of what historically made this country great, which was our willingness to assume the responsibility ourselves. Let me just assure you, we shouldn't be surprised that the results of the assessment of health care, of the government running health care, mean job loss, increased cost. We've got to make sure that we provide more choice, not less choice. We've got to get the American people engaged in negotiating their health care cost, not letting the federal government negotiate your health care cost. I came here for the first time 18 and a half years ago. I worked for a company of 50 employees. I came to the United States House of Representatives and chose the same plan in Winston-Salem, North Carolina I had with that small employer. The only difference was that when I got here, the federal government paid 75%, my employer paid 75%. I paid 25% here, I paid 25% there. I got exactly the same plan, the same coverage, everything was identical. When I left Winston-Salem to become a member of the United States House of Representatives, my cost of that health care plan was $105. When the federal government got through negotiating my same health care plan, it went up to $160. I knew on day one I did not want the federal government negotiating my health care because it meant higher prices and no change in coverage. The reality is that I think many Americans have realized that about Obamacare today. And my hope and my plea and my prayers are that Thursday the Supreme Court nullifies this bill and this Congress is challenged with going back and step by step or in comprehensive fashion, we write a health care bill that includes the participation of the American people, puts responsibility on everybody. Everybody in America should have the responsibility to pay something when they go into access. It doesn't matter whether it's private insurance, it doesn't matter whether it's Medicare, it doesn't matter whether it's Medicaid. If we want to financially solve the hole we're in this country, then we've got to income test everything that comes out of the federal government. That means people that have more pay more. It means people that have less pay something. But we've got to be a country of unlimited opportunity and not of unlimited handouts. A February 2012 Gallup survey found that 48% of small businesses are not hiring because of the potential cost of health care. Studies indicate that the law's innovative tax killing on medical devices could cost an additional 43,000 jobs in America. The President's health care bill is the wrong prescription for America. Regardless of the Supreme Court's decision this week, it's clear we must advance common sense, sustainable reforms that actually fulfill the promise to lower health care costs. Without that, America should be outraged, and I believe will be outraged.